I recognize the member for Surrey South to move the motion.
Thank you, Honourable Speaker. I move that be it resolved that this House supports scrapping this government's decriminalization experiment. I really appreciate, Honourable Speaker, the opportunity to rise in this House and speak to this morning's motion regarding decriminalization. And I'm going to predict something right now, that every speaker on this motion from across the chamber is going to fail to address the many negative consequences and population-level harms that they've caused. And instead, they're going to try to excuse their abject failure by saying that they've done this under the support of this entire House. So I'm going to be clear. There has been no prior to debate on decriminalization in this chamber. There is no provincial legislation on decriminalization. The decriminalization pilot is an agreement made by the BC NDP and the federal government. Like many times before, this government relies on wordplay. This House accepted recommendations of the Select Standing Committee on Health, but the agreement on decriminalization, how it was going to be implemented, how it would be measured and managed, was entirely planned by the NDP and approved by the federal government. When the committee was only a month into its work, that's when this happened. It would have never mattered what that report said. The NDP promised to fast-track decriminalization in their 2020 election campaign. They had an agreement with the feds, and they were going to go ahead with their plan, their strategy, their failure, no matter what the committee recommended. However, the Select Standing Committee did agree to recommend the pilot under strict conditions outlined in the federal government's letter of requirements. And I'm going to run through that for this House. This is directly from the Select Standing Committee. They agreed that there must be consideration of local needs and circumstances during implementation of decriminalization. In this regard, members supported the consultation and support for municipalities. The committee discussed the letter of requirements that supports BC's exemption under the Federal Controlled Drugs and Substances Act, which outlines further to the commitments made by the province to help support the successful implementation of the exemption. So I must say, Honourable Speaker, that although the Select Standing Committee supported the recommendation, after February, when the decriminalization pilot went ahead, that's when they changed the recipe. And I have to say, it quickly became clear that the NDP, or the federal government for that matter, they weren't living up to the letter of requirements. And one example of this is the promise of a monthly dashboard. It's supposed to show the public the results of this experiment. And this was quickly changed to a quarterly snapshot. Well, what does the snapshot show? The April 2024 snapshot shows the following. It shows that there is a decrease in people going to supervised consumption sites and overdose prevention. It shows that there is a decline in drug checking utilization. It shows that there's a decline since March 2023 of people who are getting prescribed alternatives. It shows that we have incredibly low numbers on people who are getting proactive outreach. It shows that we have a plateau since decriminalization of people being connected to care for opioid agonist treatment. But you know, one of the saddest parts, Honourable Chair, is that it doesn't show any evidence that it's helping anyone. In fact, on the one-year anniversary of the decriminalization pilot, former Chief Coroner Lisa Lapointe actually said that there's insufficient evidence for her to say whether or not decriminalization could have prevented any deaths or whether it's effective. But you know what? This government doesn't track any unintended consequences either. That's brought on by the fact that it did not abide by any guardrails. But the public didn't need a dashboard to see what was happening anyway. All they had to do was look around, look at the rising public drug use, not only in parks, in playgrounds, but we've also become alive to rampant illicit drug use in our hospitals. And this is all as a result of the NDP failing to put any regulation in place. We do not have decriminalization in BC. We actually have default legalization. There's no administrative penalty or process to act as any deterrent to antisocial behavior that is accompanying drug use. Portugal has a process to do this. Oregon has now converted to a process to do this. It's missing, and the reason why we have rampant drug use in BC is that this government has failed to put any accountability into the process. It has failed to put in any guardrails, and I strongly urge all members to please support this motion.